I'm Dr. du Plessis, Dr. Anne-Marie du Plessis. I work for SCP Radiology as a private radiologist.
My name is Simoné. I'm a diagnostic radiographer at SCP Radiology.
So people often ask what the difference is between a CT scan and a cone beam CT. Basically, you get exactly the same information from a bony point of view, so temporal bones. We use it a lot for extremities. The cone beam CT use it for extremities, so wrists, elbows, shoulders, all the small joints. And the reason for using a cone beam CT is the radiation is anywhere between half and a third less than a conventional CT. It's a quick scan, you get the whole set of information or whole set of images you require, and it's at a lot lower radiation to the patient. So specifically in children with sinus problems or hearing loss, it's fantastic because they're exposed to a lot less radiation.
Most of our scans is focused on the sinuses, the inner ears, as well as the mandibular area, which is focusing on the teeth. For the preoperative planning of cochlear implants, we do have specific positioning of our patients, which enables the referring physician to do their preoperative planning correctly.
Hearing loss you can either have complete normal anatomy, and we never really find the cause for hearing loss, and the other is that the patient might have a structural abnormality, so born with abnormal inner ear structures. That's a hearing apparatus in the bone at your skull base, or maybe a nerve problem, and so we can make a diagnosis on the imaging to say this is the cause for the hearing loss. A cochlear implant for this patient is going to be helpful, or it's not going to make a difference.
It's definitely beneficial for children due to the lower radiation dose, and also focusing on the smaller area, providing those detail for the doctor to use when they go for cochlear implants. Once you walk into the beautiful reception of SCP Radiology, you will be welcomed by our reception staff. The radiographer will come and welcome you as well and go through all the necessary identification. You'll be taken to a cubicle where you will be provided with the necessary patient gown. The radiographer will take you through to the cone beam CT room, where you will be positioned on the bed, laying down, and will position your head within the cone beam CT under the laser. And if it's your sinuses, we'll position you on different equipment, but in the same position. Your head will once again be strapped over the forehead, and we'll ask you to lie very still and just have shallow breathing. I'll go to the radiographer's console area. We will then start the scan. The scan takes around about 5 minutes. If we're happy with the scan, then the patient is good to leave.